This morning, we're looking at the surging popularity of telemedicine. Virtual doctors' visits soared during the pandemic, and they still remain high even after the end of the public health emergency. So according to data out last year, about 10% of all outpatient visits are virtual. Before the pandemic, it was just 1%. And when it comes to mental health, about 57% of all appointments are virtual. That's compared to just over 3% before COVID. CBS News medical contributor, that's Dr. Celine Gounder, is here with advice on how to use telemedicine and when to see the doctor in person. She also, by the way, is editor-at-large for public health at KFF and joins us at the table. Good to see you, Dr. Gounder. What do you think is the best use of telemedicine, in your opinion?
Yeah, there are a couple of different instances. So, for example, if you have a cough, cold, something pretty minor like that, that can be handled on telemedicine, particularly now that we do have at-home tests, at least for some things like COVID. Chronic conditions like high blood pressure, diabetes, if you have home monitors that allow a doctor to remotely adjust your medications, and then things like mental health, which we know is probably the biggest use of it, and then things like contraception, where you can have that conversation, and unless you're planning to go for an IUD, all of the other things can be prescribed without an in-person visit.
But I always think the doctor needs to touch stuff, feel stuff, hear stuff, and really look at it eyeball to eyeball, no?
Depends on what it is. So me as an infectious disease doctor, I might need to listen to your lungs to see if you have pneumonia. I might need to feel that lump or cyst and see, is it full of pus? Is it infected? Is it hot? So it really depends on what it is.
So one of the things that I think is interesting is that we are becoming a society increasingly where we don't actually hang out with each other. Yeah. We don't do anything in person anymore. Right. I get it that during the pandemic it was necessary. But I sort of feel as with Gayle, what she's saying, that you want that personal sort of bedside manner that you get. And if it's not possible, why not just a phone call? Why do I need to actually log on to Zoom or log on to some app? I might as well just call the doctor if I just need a script filled.
Well, that is about being able to bill for the visit, because if you're just putting in a phone call, you're not able to bill for an entire visit as the healthcare provider.
Plot thickens.
So what are the risks when it comes to telemedicine?
Well, the main concern is if somebody has something really serious, like you're having chest pain, you've had a facial droop, but that could be signs of heart attack or stroke. Are you calling 911 as quickly as you should be, or are you sort of saying, it's probably nothing, I'll just do telemedicine? That's, in my mind, the biggest risk.
I got you.
Well, back to the money part, because during the pandemic, insurance would cover it. Is that still the case?
These things are in flux. I don't think many people will see much of a change until the end of 2024. The biggest change you might see is that the platform people are using may change. So you won't be able to FaceTime your doctor anymore. They might ask you to log on to the hospital site. But big picture, between now and the end of 2024, no major changes.
Do you think when you're a first-time doctor, not first-time doctor, but when you're seeing a patient for the first time, don't you think you should always see that patient in person?
Not necessarily the first visit.
No?
There's some circumstances where maybe you live in a rural area and it's really hard to get to that specialist. Maybe you can't get time off work. I'd rather you have a visit than no visit. But in general, if it's going to be a long-term relationship, I do think you should have at least one in-person visit with that doctor.
But are doctors at risk of, there's a lot of risk for doctors, because if you are just asking somebody to show you, hey, show me that little rash on your hand through a telemedicine visit, and it's misdiagnosed, that could be problematic, not just for the doctor, but also for the patient.
Yeah, I mean, certainly. And so you want to make sure that you're only managing through telemedicine what you can really do that way. So, I think with the wearables, the at-home monitors, that is going to open things up a lot. If you can check somebody's temperature, their heart rate, their oxygen levels, their blood pressure, their weight, that already allows you to manage a lot remotely. But especially for something like you're describing, a rash, you may well want to see that in person.
And ultimately, at the end of the day, so many symptoms overlap that you might end up saying, hey, you know what? Come on in anyway. So then I just wasted an hour for something I could, I could have done the blood work while I was there. Anyway.
When you strip away all the confusion, don't play your own doctor, is what you're saying.
Don't play Dr. Google.
Don't play Dr. Google. All right, Dr. Gounder, thank you.